Dr. David Levine. Today is April 10th, 2022. I'm in San Diego at the American Association of Plastic Surgeons meeting, and I have the honor to be an interviewer for the ICON Project. The ICON Project essentially is the concept of preserving an audiovisual format on icons in our society that have been forward thinkers, educators, organizers, things that are done that we're aware of and things that were done that are not aware of that have made us the greatest specialty, in my opinion, in surgery. I have the privilege today of introducing and interviewing Dr. Barry Noone. Thank you, sir.
Hi, David.
Good.
Great to be here.
Okay, would you state your full name, date of birth, and a little bit about your parents, their names, and about your wife or children, just in a short.
My full name is R. Barrett Noone, and I was born October 30, 1939. My parents were Robert Noone and Margaret Barrett Noone, which is where I got my first name. And I was born in Scranton, Pennsylvania, and grew up in Pennsylvania. I've lived in Pennsylvania my entire life, except for military duty during the Vietnam years. And I met my wife when I was in medical school at Penn. Her brother was a friend of mine, and he was in medical school, and he introduced me to his sister. He said, "You've got to meet my sister." I said, "I've heard that before." Her name was Barbara, and I met her, and we've been married now for 56 years and have 5 wonderful children and 13 grandchildren.
Wonderful.
And it's been a great ride, and it's been a wonderful thing to do.
Well, I want to read some of your accolades. I should have done it when I first introduced you, but I have to look down at them because they're a bunch. But you retired in 2015. You're the past chief of plastic surgery at the Pennsylvania Hospital, a past chief of surgery at Bryn Mawr and Lacanau Hospital. Pronounced correct? Lacanau, did I do that right?
That's correct.
Okay. Past president of the American Association of Plastic Surgeons, which I want you to, as the first executive, well, we'll talk about that too, but past president of the American Association of Plastic Surgeons, distinguished fellow award for the American Association of Plastic Surgeons. This is why I have to read this. There are a lot. Over 100 peer-reviewed articles. You're a pioneer in early breast reconstruction. This is what was sent to me by on the legacy of R. Barrett Noone. He was instrumental in introducing the early concepts and techniques of breast reconstruction at the time of mastectomy, a pioneering concept in the late 1970s that has become a standard of care for the breast cancer patient. Dr. Noone is the first executive director of the American Board of Plastic Surgery, which wasn't until 1997, which is an interesting story unto itself. And he's the American Society of Plastic Surgeon lecturer in different topics referable to that, and I assume other things. And would you like to touch on a few of those things? Because you said that was important, so we're going to get to that right off the bat.
The board or the association? Well, the association has been a love of mine forever. And you mentioned distinguished fellow. I'm most proud of 2 things at the association, besides being past president. Every year there's a president. And I'm honored to have received the honorary award, which is the highest award given by the association, and I received that. The honorary award is not reserved only for a physician or a plastic surgeon. It can be given to anybody with contributions to medicine. And the other association honor, of course, has been the lectureship, which was endowed for me on retirement from my board position in 2015, my American Board of Plastic Surgery position in 2015. The board endowed a lecture at the association in my name, and it's only the 3rd lecture. The first is the Kiskaden Lecture, which is an early president. The second is the Murray Lecture, which is named after Joseph Murray, who was the only plastic surgeon to receive a Nobel Prize, and then this one after
For kidney transplant.
for kidney transplants, and this one after me. And so I think it is a real pleasure, and I think that is that's my dedication to the association and my relationship with the association.
Now
The board is another topic.
okay, we'll get to that, but you're in a small select group that they would pick. If the other two that you mentioned, is there any particular, when your lectureship is voted on, is there any particular aspect, or do they just decide, hey, we need to talk about this or that?
Well, the lectureship is selected, the lecturer is selected by the president.
Okay.
And it rotates with this Kiskaddon lecture one year, the Murray lecture another year, and then mine. So it's every 3 years, and the president of the association picks the lecturer.
Okay. All right. Now, the other thing that you wanted to get into was the board.
That is a real interesting topic. And David, you remember back in the 80s and 90s, the conflict with otolaryngology about facial plastic surgery?
Sure.
You want to hear? Is it okay to talk about that?
Every single interviewee has talked about this. Yes, I do want to talk about it because it's important.
My relationship with this is very close because the American Board of Medical Specialties, which is the parent organization of the 24 certifying boards, was dealing for a number of years with otolaryngology wanting a sub-certificate in facial plastic surgery.
Right.
And our specialty was dealing with that. And the problem that we had is we really did not have continuing representation at the American Board of Medical Specialties. Otolaryngology, orthopedics, urology, all had an executive director who would go regularly to the ABMS meetings and attend them and represent the specialty there. We did not have an executive director or executive director / CEO. And realizing that this was a problem, the American Board of Plastic Surgery sent out a search in 1997 to find someone to do this. And 15 of us applied for the position, which was a part-time position, and it always has been a part-time position. And I was fortunate enough to be selected to do that. So we went to, the biggest challenge was what to do with this facial plastic surgery request by otolaryngology at the ABMS. So I was thrown right into the middle of that, and it was a very challenging spot for our specialty, and I really got into it quite a bit because what we did, the American Board of Medical Specialties at that time was getting very tired of two small specialties fighting every year, et cetera, to try to get this thing settled, and we didn't have any representation. So what we came up with was a solution that, okay, we shall both have a subspecialty certification in plastic surgery within the head and neck.
Okay.
For both specialties. And we need to write the requirements for someone to take a fellowship or to whatever requirement it would be to be able to sit for that sub-certificate. So we formed committees, and otolaryngology lost interest.
Huh.
And our
I would have thought they'd have jumped on
plastic surgery within the head and neck was not what they wanted. They wanted facial plastic surgery. Big difference. Plastic surgery within the head and neck meant reconstruction, meant radical necks, it meant jaw resections, and the whole thing that plastic surgeons had been doing for a long time up until that point.
Right.
And that was an issue, and they were not interested in that. So that still is on the books at ABMS. And neither specialty has ever examined anyone in plastic surgery within the head and neck. So the whole facial plastic surgery subcertificate died with that. And that was the solution to the problem.
And historically, I want for people viewing this, the turf battle was that the ear, nose, and throat said we have an American Board of Cosmetic Surgery, and their qualifications were. And I'm not being slanderous because I know there was a lawsuit regarding that many years ago. I'm not. But they would have a weekend course that you go with somebody who is also not a plastic surgeon normally. Sometimes spend a weekend with them or 2 weeks with them, and you came out learning how to do breast augment. As Jim Lehman, my chief, used to say, if it were easy, everybody'd be doing it.
That's correct.
And that was our turf battle, was we want you. We understand you do facial plastic. You do great noses, Johnson in New Orleans. There were leaders in ear, nose, and throat. But this battle, we want to go below the ear, nose, and throat area.
That's
and
correct.
add another T.
And that's really critical, because the Academy, the American Academy of Cosmetic Surgery, had its origins in otolaryngology, its origins. And they wanted to make cosmetic surgery a separate specialty.
Right.
Okay? And I can get into that if you'd like, about Congress, etc. And gosh,
Please do.
we're now back in 1989, and a congressman from Oregon,
Hatch.
Ron Wyden.
Oh, Wyden. Okay.
Ron Wyden, who was then a representative from Oregon and is now a senator from Oregon, was in Washington, and he asked for, well, what happened is a patient had a complication in Oregon. What do? You go to your congressman, okay? Without getting into the complication. But so he looks into the qualifications of people doing cosmetic surgery.
Right, I remember this now.
And this was a hearing, and I went and testified for the American Board of Plastic Surgery at Congressman Wyden's hearings in Washington, telling them what our qualifications were: residency, training, examinations, the whole bit. There were representatives there from otolaryngology, talking about facial plastic surgery, which is one topic, but there were also representatives there from this upstart group, the American Academy of Cosmetic Surgery, which was entirely different, although many of them were otolaryngologists. And they were testifying also about their training, and this went on for a number of days, and I've remember it very well, sitting testifying with 35 millimeter slides in the congressional hearing room about the qualifications. And in fact, that's when they started. But what happened at that American Academy of Cosmetic Surgery is it really became a dermatology group. They phased out the otolaryngologists, went their way with facial plastic surgery, even though they never got a sub-certificate in it.
Right.
They practiced it. And and they did some liposuction once in a while, and some below the neck surgery, but it never became a big part of otolaryngology at all. And so we did fine at that particular point. And Wyden, who was a very interesting guy and did a nice job with this committee, I enjoyed meeting him and I enjoyed testifying there. He basically said that it was up to the societies and the state licensing boards to do what they needed to do to supervise physicians, and it was not a national problem. That Congress really didn't need to get into it.
Yeah, and I understand that. It's interesting, based on my little world in Fort Worth, is that most of the otolaryngologists do very little of the other. At first, they all want to do it, and you're right. Dermatologists, and I'm sure they're saying, why do they get to do that? It passes, they're passing it forward, or we're passing it forward. Now you can deal with it. When, an internist is doing the liposuction, which amazes me that they would do that, and other specialties, because they took the 2-week course. Well, you created this monster, if you will. Now you can deal with it because you're all fighting for the same scraps. And this is why I appreciate what you're doing. And I was shocked to find it wasn't until the 90s, when you were appointed as the head of the board, is that we've always been the cream at the top. And I'm not just saying that because I'm doing these interviews. We are. And so the other guys, okay, we're getting the big piece of meat. You can fight for the scraps. Ultimately, it will come back to us because the bar that we have is much higher. Or, to get over that bar, you've got to be pretty good. You've got to deal with the complications that occur with anything. Nothing is that easy, and as another professor of mine used to say, there's no such thing as minor surgery, just minor surgeons. Please continue. I thought I'd throw my philosophy.
You are absolutely right. I think the real quality of our specialty is the training, the residency program, the education. One of my greatest joys of this whole experience has been the fact that I worked directly with residents for 42 years, teaching them at Penn, and I'm involved with over 100 residents trained, and that was a real joy to help with those people, and they are superb because it's a very difficult specialty to get into. Matching out of medical school into a integrated residency in plastic surgery is a very competitive job.
Right. And that's changed a little bit. And you answered one of my questions, was your joy. I would think from your answer that teaching residents has been your greatest joy professionally.
Professionally, but my greatest joy, obviously, are my 5 children and 13 grandchildren. And
good answer.
They really are. I mean,
I get it.
I've got of the 5 children, all are involved or have been involved in some way with the care of the patient. My son, who's the oldest, is a general surgeon, colorectal surgeon. My second daughter is a PhD school psychologist who worked in school psychology for many years. My third is a pediatrician who happens to be practicing here in La Jolla. So we're very close to Genevieve. My fourth, Becky, was a skin care specialist. And my fifth, Teresa, is a nurse practitioner, nurse midwife, who works at Children's Hospital in Philadelphia, delivering babies at Children's Hospital so that the high-risk infants can be kept there in the intensive care unit. So all 5 children, I'm very proud of them, and they've done very, very well.
Well, that's a great medical legacy. Very common, by the way.
Oh, sure.
I mean, my father was a doctor. His brothers were doctors and dentists. But I think that respect that we get as being a physician and in a specialty passes down and inculcated in our children, hopefully. And if not, at least they know what it is to work hard and to achieve.
They do. And as the first child in my family to go to college, to graduate from college, I appreciate what these children have done.
Yeah,
I really do.
And how did you pick plastic surgery? Did we even get into that?
No, you didn't ask that. Do you really want to hear the story?
Of course I do.
Oh.
We got nothing to do today.
We have nothing to do except talk. This is great. This is great, David. No, how did I get into plastic surgery? Well, when you're as senior as I am, there were rotating internships. You graduated from medical school.
Right.
You did a rotating internship and then you picked your specialty, but you had to rotate through all the specialties, pediatrics, OBGYN, and what have you. So I'm rotating through, and my first rotation was on OBGYN. And I said, oh, this is great. This is for me. Mm. So I had good exposure in medical school to OBGYN, and we had, I liked it. I got to deliver some babies at Philadelphia General Hospital, which was a city hospital, and this was great. Uh-huh. So I rotated on OBGYN. I said, I want to go into OBGYN for a specialty. So that was my goal, and then there was no match for a residency. You basically applied to whatever program you wanted to apply to, and then you got the job as a resident. So I was all signed up for OBGYN, and along came January in Philadelphia, and I'm rotating on pediatrics for 2 months. Now, January and February on pediatrics in Philadelphia is a bunch of with all due respect to pediatricians who do a great job taking care of these things, it was not that exciting for me to take care of the runny noses and what have you, and the clinic and the hospital. So I'm doing it because that's what my job, and I'm trying to do my job as best I can. And at the end of January, my friend Marcia came down to the pediatric ward, and she said, I said, Marcia, why do you have that splint on your hand? Well, I cut my tendon yesterday on my first month of surgery, and I can't do surgery. And I said, oh, that's a shame. She said, you have another month. She already had her residency at Boston Children's. She had gone to Harvard. She had a residency in Boston Children's in pediatrics, and she was ready to go in pediatrics. She said, will you trade your second month of pediatrics to me for surgery? And I said, sure. What is it? She said, it's plastic surgery. I said, well, that'll help in obstetrician. I'd be able to make the episiotomies look better, and stuff like that. So I said, sure. So I go up to the OR the next morning, and Marcia says, I introduced myself to Bill Graham, who you may or may not know, who became the chair at Hershey.
I know the name, but I never met.
Many years later. So and he was the chief resident, and he said, what are you doing? You're the guy who's succeeding Marcia, who we repaired her tendon 2 days ago, and now you're here. I'm taking her place, and they gave me permission to do this. So I got interested in plastic surgery because of that fact, and it was a wonderful month. So I had to change my mind going from OB into plastic surgery.
Okay.
And I had to go through some difficult things, namely get a residency and get out of the other residency that I was already committed to and what have you. It was a difficult time. But Dr. Rhodes at Penn was very understanding, and he was very good. And I had lost my berry plan deferment from the military, and I had a full deferment in OBGYN. And
did you go to the GMO?
No, I was lucky because they kept me at Penn for one more year. So I went in as a junior level general surgeon in the military.
Oh, okay. So you got some experience.
So I got assigned to general surgery, and which was a great thing. And that worked out very well. And then I came back to Penn and finished general surgery and plastic surgery. But it was that's how I got into plastic surgery. Never saw it before. Never knew anything about it. But it was a wonderful month. I mean, we saw everything you know about plastic surgery. And you can't, as you know, David, you can't compare the surgery that goes on with plastic surgery with the surgery that goes on in gynecology. It's entirely different.
Yeah.
And so I got really interested in it, and it worked out very well.
Well, I'll tell you my story when this is over, because this is about you, about how I happened to get into it, because it's not too dissimilar to your experience. And you've seen momentous paradigm shifts in plastic surgery during your illustrious career. Could you just mention a few of them that you've seen, the changes, paradigm shifts?
Yeah, I think that when you really think about that, David, I came along at the right time.
We did, didn't we?
Right place, right time. And I always call it the golden decade of plastic surgery. 1972,
That's exactly right.
1982. Everything happened during that time. And since then, modifications. But I think 1972, I was still a resident, chief resident. I finished in 1973. And in 1972, Tessier came to Children's Hospital in Philadelphia. And I was a chief resident, taking care of these craniofacial patients that he was operating on and showing us craniofacial surgery. That was the start of the golden decade.
Yep.
And then everything followed after that. Microsurgery. I went to California to learn from Harry Bunke how to do microsurgery. And that was 76. The whole concept of the myocutaneous flap was developed at that time, as you know. And so that 10 years, and that 10 years finished in 1982 when I was asked to be on the suction lipectomy blue ribbon panel. I was one of the youngest guys on that panel, which you probably interviewed all the icons that have been on that panel, including Ron Berggren.
Yeah, I did.
But we went to Paris and in December of 1982 and learned suction lipectomy from Elouse and at that time. So that whole 10-year time frame. And after that, multiple modifications, obviously.
Absolutely.
Using the myocutaneous flap as a free flap, and all the other things that came in after that were very important. But that was a wonderful time to be starting practice, to be finishing residency, starting practice, and what have you. And then later on, in 1981, which is at the end of that golden decade, the oral exams at the board left and became independent oral exams in 1981 in Chicago.
Well, that was the golden age of plastic surgery.
It was really
and we're
great.
lucky because what we've seen, everything shoots off of that. Now, there may be another golden age. I don't know. It may be in tissue growth and transplantation, but we saw many changes occurring simultaneously and interrelated. Breast reconstruction, microsurgery, craniofacial, cosmetic deep facial surgery. We took it to another degree. Sometimes we took it too far, had to back off, but that's what plastic surgeons do. We always push the edge of the envelope.
Right. That's correct.
You mentioned your greatest professional accomplishment with regard to the American board and your breast reconstruction. What do you? I probably know what your answer is going to be, but our greatest mistake is a medical specialty. Plastic surgery. What is our greatest mistake? The American society.
Greatest mistake?
Yeah, we talk about the positive. What do you think the greatest mistake is?
I think that's difficult to answer because we haven't made a lot of mistakes in plastic surgery. I think we've really done very well with what we're doing. I think probably the greatest mistake was to allow a gradual separation between cosmetic surgery and reconstructive surgery to occur. And that is a natural, I guess it's a natural evolution, but it's backed up by socioeconomic things, the whole insurance industry, and all these things come in, so that was I hated to see that happen, but I don't know where it's going to go. I think we need to keep both together for sure.
Well, I didn't like in Burt Brent that I talked to earlier, I talked to yesterday about taking reconstructive out of American Society of Plastic and Reconstructive, because we were too much in the moment. But I said, I'll bet you in 20 years, 25 years, that name will be back in. That it'll be revoted in, because that's really what we do. We just, at that time, it was a golden age. People talked about things nobody would talk about. Women talked and men about their cosmetic surgery. Now, as I was talking to Dr. Ruberg, now you see the before, after, during on on Instagram. And before it was like, no, I didn't have anything. I hit the wall. I did my bruisings from this or that. Now it's, I had a facelift 2 weeks ago. So and so did. You need to go to get the point.
Yeah, I think that's what I didn't like to see that, and hopefully it'll come back.
Yeah. Who do you admire most professionally or personally?
Plastic surgery?
Yeah, anything or personally.
I really have to say, my early mentor after I met Bill Graham was Henry Royster, who was a pioneer at Penn and started the residency program, et cetera, and asked me to join him in practice when I finished residency. He was an early mentor and a very good mentor to me. But over the years, the person I probably admire the most is Bob Chase, who I met. You really want me to get into all that?
It's your time.
He came to Philadelphia from after he was chair of surgery at Stanford, and I got to know him very well because he called me. I was working at Pennsylvania Hospital. Hadn't even taken.
He came to Philadelphia to teach, to take a position or to teach it.
To take a position as president of the National Board of Medical Examiners.
Interesting. All right, I didn't know that.
He was there for 4 years, and 3 to 4 years, and he was living in a part of town near Pennsylvania Hospital, and he called and asked if he could share an office with me so he could keep teaching residents. So he teaching hand surgery to residents, and I said sure. So he and I shared an office at Pennsylvania Hospital, and I got to know him very well, and he was a real mentor. He got me interested in microsurgery and in examinations, because he was running the National Board of Medical Examiners, which does all the exams for medical students, as you know. So I got interested in that, and that led to a lot of the associations with the board, et cetera, later on. And he's always been, to me, an icon, and I admire him. He's still alive in the late 90s. And
he's still coherent?
Yes.
Well, why don't we get him for an interview?
Oh, I don't know. He probably can't even travel, but
Where's he live?
He lives in Florida.
Well, maybe there'll be a meeting there.
Ocean Reef, Florida. No, he's definitely coherent, and he's an amazing guy. So I think that's probably the person I admire most.
Okay. Any words of wisdom for present and future residents of plastic surgery?
Well, I assume you're a resident and you're looking to go into practice. I really feel that in this day and age, the day of going out and hanging up a shingle and becoming a plastic surgeon is very difficult for many, many reasons. And you know all about this.
Yes.
It's difficult to do. So my words of wisdom are to focus on a subspecialty area. I don't think they're going to do what we did, David. They're not going to go out and practice the whole specialty unless they're in a certain area of the country.
The right niche.
In the right niche or where it's going to be. So probably a fellowship is a good idea. And then use the fellowship as a stepping stone to a practice in what's probably going to be a group. It's either going to be a big private practice group, the way things are going now, or it's going to be an academic position in a group, and that's what's going to happen. And I think they ought to prepare for that.
Okay. Any predictions for plastic surgery in the next quarter century?
Quarter century. Boy, I'll tell you what.
You can go crazy with it.
If we're 20, you can go crazy with that question. But I really think that our specialty is, seriously, if you can solve the immunosuppression problem with something as simple as an aspirin, and it sounds crazy, but I think it can be.
I know.
They're going to work on that.
Remember when HIV, they had 25 pills a day. Now they take one a week.
Right. If you can solve the immunosuppression problem easily, then the entire field of allotransplantation is going to open up for plastic surgery. Deformities that you would not think about doing now, because if he had a total facial burn and it was unrecognizable, you do a face transplant.
Right.
And you immunosuppress the patient to the hilt.
Right.
And you have life-threatening medications in order to get that face to survive. If you can solve that problem, then it becomes a real, I mean, you can just picture plastic surgery doing anything.
Yeah.
And that's one thing. And I sort of think that's going to happen in the next 25 years.
It's one of the interviews that I did, and it was a play on words, really, but in sense of truth, that I eventually will have total body transplants.
It might.
Now, that's...
You never know.
Yeah,
I mean, we're doing abdominal wall transplants, and that's coming. Thoracic transplants are coming. They're on the forefront. And the question really is what we're going to be, and then the other topic is, of course, tissue engineering.
Yes.
Which is the other, and you've heard all about this, but we could get to grow from stem cells, we could get to grow in the laboratory, organs, tissues, what have you, and that's going to come in the next 25 years too. So both of those things are going to be parallel. And does it have anything to do with cosmetic surgery? Sure. In other words, somebody may say, I'm going to look better with that face. And who knows? 25 years is a long time. And a lot of things are happening in medicine all the time to impact plastic surgery.
And there's a 50-50 chance it'll be something we never thought about.
Right.
Yeah.
That's exactly right.
Right. Any other questions or particular things you'd like to highlight? And before I forget, just mention, did COVID affect your life? You know, in January 1 of 2020, the first COVID case came to the United States and affected a lot of lives, affected a lot of practice, affected a lot of marriages.
Well, fortunately, neither I nor my wife got COVID. And I don't think it really has been a big factor in my life. I'm retired from surgery and no longer take care of patients. And actually, it was, except for getting on the vaccination list and what have you, it was just something out there that we saw in the news every night. And we had one child at college, one grad child. We have 13 grandchildren. And one of them was at college, and she got infected and had some long-term effects from it. My son he was positive and what have you, but so it was the younger people in the family rather than those of us who were locked in, reading, writing. I got into writing a book, and
so you made good, positive use of your time.
I did. I spent a lot of time.
You didn't sit around drinking all day.
No drink. The drinking didn't change. No, just a little bit. And I've been writing a book, which I'm hopefully going to finish in the next month or two, for the lay person, about plastic surgery, what it's done in the last 100 years. This is for.
Are you going to send me a copy?
I am. This is the book club. This is the book club book for the book club. You might want to. Your family may want to do.
Well, you know, you mentioned, and we'll finish up the interview, but one thing I've noticed, and I think it's by virtue of the fact. Now, I came from a medical family. I had the first polio vaccines. You had that. We are so exposed in many doses during our residency and practice. We are so boosted up that, I mean, I've had friends that had it. I could get it, so I'm not going to say knock on wood, but there are variants now. But I think we had that built-in immunity. I shouldn't say built-in, acquired immunity over all our career of being exposed to other people in a close situation. So anyway, Dr. Noone.
Am I your last interview?
Yes, sir, you are.
How about that?
What a pleasure. Thank you so much.
David, great to be here with you.
Satisfied with everything.
That's right.
All right.
Thank you.
Thank you.